Welcome back to Channel One TV Sunday Breakfast with me, Jude Duncan. Just gone by a conversation with my co-host and I'm having with Apio Core on the literacy challenge. Now we get to tell you about a beautiful story, really an inspiring story of 25 years of excellent healthcare delivery, and I'm talking about the Raphal Medical Center. Joining me in studio, the medical director and administrator of this really remarkable health facility in Accra, Ghana, Dr. Michael Deladem Kwashi and Belinda Ado. I believe I got the name right.
Yes.
Thank you. Wow. Thank you so much for joining us here on Sunday Breakfast. 25 years, incredible story, really. How did it all start?
Thank you very much, and good morning to all the viewers. So Raphal Medical Center started 25 years ago when the late Dr. Johnson Ado and wife, Mrs. Diana Ado, saw a need in Tema and Accra for quality health service delivery. And visionaries as they are, thought that they should start a facility that will meet the need of the people of Tema, provide quality health care that is patient-centered. And so on the 15th of March, 1999, they started Raphal Medical Center at Community 1 Tema, just behind the TDC. And so that was basically how Raphal started and has grown over the years. In the year 2006, they established a second branch to also cater for another need. So they realized that not everybody could afford a certain level of healthcare. So they needed to provide healthcare service to all facets of the community, all people in the various economic ranges, and so established two main branches that could cater for the various.
Interesting. Raphal, an interesting name. I don't know, for some of us growing up in Sunday school, we're learning about the attributes of God, right? They say Jehovah Shammah, Jehovah Rapha was part of that, which means a healer. Is that the inspiration behind the name?
Yes, please. So Rapha, the healer, is at work.
The healer is at work.
Yes. And so the founders, being very devout Christians, thought that God or Jehovah Rapha, God is the healer.
God is a healer. Yeah.
We believe that when you come to Rapha, God himself is at work and he's the healer.
Interesting. Let me come to you, Belinda, sorry.
Yes.
I don't know how I just got the name wrong. Yeah. Just talk to us about the services really you offer there. We saw the video. Quite an inspiring story, really. All of the staffers in there talking about the various things you do. But just briefly talk to us about the services really you have there, if there are any specialty areas you guys dwell on.
Thank you very much. So we have the child welfare clinic, and then we have the pediatric service. We have the general surgeon. We have the ENT clinic as well. We have the dermatologist service. We have general surgery, and then we have ophthalmology service as well. Yes, these are the services we render.
And over the years, I understand you prioritize patient care. How's the feedback been like? What's been the success story 25 years down the line?
Okay, so you know, we focus on patient care, and so feedback to us is everything. And so some of the things that we have put in place is we have a business development office where we take surveys, OPD surveys daily, inpatient surveys, just to find out what the feedback is on a daily basis. We also reach out to our clients after care service. So if you attend the clinic today, the next day we're going to call you to find out how the service was. Was there any concerns? Are there anything you think that we can do to improve on the services? So we focus on the patient-centered care. And by receiving feedback, and then we improve our services.
Wow. So if I get you correctly, at Raphal Medical Center, your value proposition then is patient care, how you treat your patients, right?
Yes.
Interesting. Wow. Let me come back to you, Doc. 25 years, incredible. What's the next 25 years going to look like?
All right. So the next 25 years, basically, we're looking at the public health aspect of healthcare. Over the years, Ghana has had infectious diseases as the predominating disease pattern, but currently there is a surge in non-communicable diseases. And so our services over the next 25 years will be much more tailored to meet the needs of the developing population, where non-communicable diseases are more predominant these days. And so we are looking at cardiology clinics, and that is well equipped, physical therapy units that will provide both preventive and rehabilitative services, renal units that will provide comprehensive renal care, including dialysis, and also on the table that is currently being discussed is the possibility of oncology units that can cater for some cancer patients. So in the next 25 years, we're looking at really meeting the needs of the Ghanaian population. As our life expectancy improves and increases, we see more of non-communicable diseases that is more common in the population, and so we want to meet that need as we go ahead.
Wow, so it's also to become a lead player within the space, right?
Yes.
Providing excellent healthcare delivery.
Yes.
Wow, but what's the current size? How many capacity in terms of bed size?
So
what are the numbers now?
So currently we have 2 branches. There's where we started from. Currently has just about 10 beds, but where the second place that we have now currently have about 50 beds. Yes, so we
are growing.
Yes, we are growing, and
wow, I like that.
we're thinking that we also want to reach out to some communities outside the main Tema enclave. So the possibility of doing some satellite stations. We're looking at the Kaswa areas and also beyond Dowenya areas to see if we can expand and send some of our quality services to those people in those enclaves as well.
So all of that in the next 25 years.
years.
Interesting. Wow. Let me come back to Belinda Ado Asante Amankwa, who is the administrator.
Yes.
I mean, are we planning a party? Like 25 years is a long time, right?
Yes.
I can imagine all that's happened within the period.
Yeah.
The ups, the downs, the down moments, the happy moments, the success stories. Is there a party to celebrate where you can invite all of us to come join you? What's the plan for your 25th anniversary celebration?
Okay, right, thank you. So on Friday, this coming Friday, we are doing a float through the streets of Tema. I'm inviting the community to grace the occasion. And then on Saturday, on the 10th of August at 9 a.m. at the forecourt of Raphal Medical Center, Community 10, we will be launching the anniversary officially. So we have some dignitaries invited. The board of directors are going to be present. We have our suppliers coming in and our specialists as well, gracing the
Joining
occasion.
you to celebrate.
Yes.
Are we invited?
Everyone,
ChannelOne TV?
ChannelOne TV is invited. Yes, yes, everyone is invited.
Interesting. So I understand it didn't just happen, right? You had people along the way who helped you, sponsors on board, trying to make this happen. You want to just acknowledge them briefly before I wrap up?
Yes. So I'd like to acknowledge some people who have really been instrumental in this. First of all, before we aired this, we played a video. We've launched a children's charity drive.
Oh, okay.
Yes, we plan to support 2 orphanages in Tema. Like I said, we focus on people rather than monetary aspects, and so we would like to make some impact in the lives of these children in these 2 orphanages. So we've had some people support us, and so I'd like to acknowledge these people.
Please go ahead and do.
Right. So Samens, the CEO of CTFM.
My boss. Great guy.
Yes, my brother. I'd like to say thank you very much, Samens, for giving us this opportunity. Mr. and Mrs. Anson, CEOs of Beautiful Creation Company Limited. Dr. Nana Ichan Ankra, CEO of Arise Foods. Mr. Harold Kwashi Ewada, CEO of Nationwide Mutual Health. Mr. Samuel Amotobin, CEO of Tobinco Pharmaceutical Company Limited, And then we have Mr. Samuel Obin Davis, CEO of EDM Africa Services, Mr. Daniel Bento, Danny's Decorations, Madam Mavis Ifia Ansa Obing, Madam Trudy Tete, Madam Olivia Chumesi, Mrs. Chrissy Datson, Madam Charlotte Abuaje, Dr. Stephen Akapo, he's a gynecologist of Raphal Medical Center, Pastor Caleb Ama, Mr. Delali Boko, Madam Comfort Kofi, Mrs. Belba Smith, Abji's Catering Services, Madam Vivian Butchie, and Madam Janet Kujo, CEO of Garden Foods. All these people have sponsored have partnered with us to sponsor for the children's charity drive.
Wow, interesting. So I like the way you're still focused on giving back to society. I think that's really remarkable, and we need to commend you on that. But beyond the 25th anniversary celebration, what should the public look out for in terms of giving healthcare, in terms of delivering on what you are noted for within the space?
Okay. So, so we pride ourselves in patient-centered care, and that is everything. And also, in order for us to improve on that, we continuously train our staff. So excellence in the delivery of the quality care is key. And so going forward, our clients and the public should look out for more innovative ideas, because we will be having some exchange programs with some international healthcare organizations as well. And so we should look forward to more innovative, more excellence, and providing you with the best quality care.
Well, I like that. Innovation, excellent, quality healthcare. Are these the values of Raphal Medical Center, or there are more to it?
Yeah, they are part of the values of Raphal.
They are part of the values. Yes. Are there any extra ones that you want to talk about briefly?
Yeah, so teamwork.
Teamwork.
Yes, integrity. And then honesty. Yes.
Wow. All right. I really, I'm in love with the name of the facility, right? Raphal Medical Center, which is out of the attribute Jehovah Rapha. Yes. I think Exodus 15, 20 something. Nice. Wow. Anyway, Doc, your final words, anything you want us to take notice of as we gear into 25 years of professional quality healthcare?
All right, so I would want to thank our clients and people of Tema and beyond. It is for them that we exist. And so I want to say a big thank you to them. They've continuously supported us, given us feedback, made sure that our services have improved over the years. And we want to tell them that we'll continue to provide very quality service to them. We'll get close to them. In fact, we provide home service as well, telemedicine. So we'll get close to them as much as possible, just to make sure that they receive the best health care that can be provided.
Is that an assurance or a promise? Or both?
Both.
Wow.
Yeah.
Belena, let me come to your final words. What should the public look out for?
Well, first of all, I'd like to say thank you very much to the general public, the board of directors, the management of Raphal, and we have a team that has really assisted in the collaboration of this and put together the launch, all the activities. So I'd like to first of all appreciate them for their hard work. Without them, there will be no Raphal. And so going forward, like I said initially, we're still going to focus on giving out our best as the quality care for us and the innovation, more ideas. And we're also looking forward to opening new branches. We are down in Tema, so we are looking forward to opening new branches in different parts of Ghana and reaching as many people as possible and impacting lives everywhere.
Super. Just before you go, I just want you to re-emphasize the dates and the children charity drive, so we are clear on that. So the dates and what exactly will be happening, then we can end it here.
Okay. So the dates for the event is this coming Saturday, the 10th of August at 9 a.m. at the forecourt of Raphal Medical Center, Community 10 Tema, and it starts at 9 a.m. Yes. Yeah. And then the charity drive will be on the 17th of August at 10 a.m. So we'll be donating to the 2 orphanages on the same day. Okay. So we'll do a morning a morning schedule at one of the orphanages and an afternoon one at the second orphanage. Yes, and so would want everybody to come on board, support us, help us make impact in the lives of these children and make a difference in their lives as well.
And how can they support? If someone is watching and they are really touched by this story and want to contribute, how can they do so before we go?
Okay, so they can reach out on this number 054 143 0756. The number again is 054 143 0756.
And you're accepting all kinds of support.
Yes, all kinds of.
Including Momo.
Exactly, exactly. This is the Momo number.
It's very important.
Yeah,
oh, it's the Momo number you gave out.
This is the Momo number I gave out. So all support, all sorts of sponsorship is welcomed.
Wow.
Yeah.
Dr. Michael Deladem Kwashi, Medical Director, Raphal Medical Center, Belinda Ado Asante Amankwa, BAA, right? BAAA, triple
Yes,
A.
exactly.
Wow, thank you so much for your time.
you.
It's been exciting having a conversation with you on a really amazing story of healing and bringing warmth to people and the sick, right? We are really grateful for your services and for joining us. All right, so listeners, there you have it. My guests, or let me say friends, I made some new friends from Raphal Medical Center.